Hey team, it's Paula Nutting here. I just thought I would do a quick shout out video and a little bit of a demonstration stuff for you today to talk about temporomandibular jaw disorders. And it's off the back of some details that I got on when we look at PubMed information. So I'm going to share the screen so that I can actually get the details of what I want to show you. I've got so much stuff open, it's ridiculous. So this is the technique position information that we were looking at. I'm just going to pause for a second. No, I'm not going to keep. I'm going to keep running off back. So you can see here it says pressure release techniques versus placebo applied to cervical and masseter muscles in the patients with chronic painful myofascial temporomandibular disorder. So what they're looking at here is they've done a study with 72 patients, and they've put half of them over a 3 month period, and they've got either PRT or sham PRT. So PRT is positional release techniques. A positional release technique is where we put the muscles at a point of ease. So we do a lot of compressive myofascial, like METs. We don't necessarily do PRTs. So if you think about a positional release technique, it's something that is going to reduce the load on the muscles. We're going to kind of close down and compress and gentlify, if that's actually a word. And they were looking at the visual analog scale, so just looking at our pain scales through there. The conclusions were of PRT to conventional management with occlusional splints and self-care management. So we don't really, like occlusional splints can be quite dramatic, but it seems to be effective to improve self-reported levels of pain in patients. So we're using the PRT to conventional management. And that's a really cool thing. I'm going to stop sharing now so that I can come back into us. And I'm just back on. Just clearing a little bit of the glare that we had here. So when we talk about METs, remember I get you guys to put your fingers at the back of the mastoid process, get the client or patient to push forward, hold that muscle group out and forward, and then get them to direct compression back. So they're contracting that muscle. So it's forward, hold, and then distract the jaw back to try to allow some alleviation of pain. When we look at PRT, positional release techniques, we're actually going to bring the jaw into an area of closure. So if it's restricted through here, and we're going to palpate. So I want you to be palpating down the masseter, into the pterygoids, and even right down underneath into the scalenes and all of those areas there, that sternocleidomastoid, that might have attachment effectiveness disorders in those spaces. So if you've got a client or a patient that you're treating and you're using a PRT, especially for temporomandibular stuff, you're probably going to have them in supine, and just find the area of tissue and gently take it into ease. So if we're looking at this left side, you're going to take the jaw, you're going to feel the masseter muscle, and then you're going to just gently distract. So you're pushing the muscle up, taking the jaw into closure, and you're going to sit there. So PRTs generally are about 90-second holds, and then you might then retract it back a little bit further. We can do closing down of the sternocleidomastoids as a secondary assistance. We can come in and do some intraoral stuff where we're coming into the pterygoids, feeling for that space where they're probably going to be most restricted. It's a little tricky to get into those. We're actually going to try to close up, and you can almost do it externally. So you can actually feel those nasty tight pterygoids yourself, pushing up and gently compressing in. So we're changing the tension curve within the muscle fiber, and that seems to have some really good efficacy. So give that a whirl, and also chuck some stuff in the comments after you've seen this on the Facebook group, and we can see if we're getting some results. So good luck, guys. Let me know how you go.